Okay, I'm doing it. Chapter 7. Nursing diagnosis. Nursing diagnosis is the second step of the nursing process. Formulation of nursing diagnoses follows patient data collection and involves the analysis and clustering of related assessment information. The use of nursing diagnosis facilitates clear communication of patient needs and promotes professional accountability and autonomy by defining and describing the independent area of the nursing practice. Nursing diagnosis clearly communicates to legislators, consumers, and insurance providers the unique care nurses deliver and the specific nature of the health conditions they treat. Use of a unified language classification system, or taxonomy, is an effective vehicle for communication among nurses and other healthcare professionals. The integration of various taxonomies into electronic medical records, EMRs, has facilitated opportunities for research and increased global collaboration with the goal of improving patient safety and clinical decision making. The nursing taxonomy and structure of writing nursing diagnosis statements developed by North American Nursing Diagnosis Association International, NANDA-I, is frequently taught in the United States colleges and universities. However, with the integration of EMRs into healthcare, identification of nursing diagnosis for patients and the documentation of supporting patient data are streamlined by the use of checklists and drop-down options. EMRs contain nursing diagnosis from several organizations, including the International Classification of Nursing Practice, ICNP, developed by the International Council of Nurses, ICN, and the Clinical Care Classification, CCC, system from SabaCare Incorporated. This textbook presents nursing diagnosis labels from the ICNP. This chapter shows students how to formulate NANDA-I nursing diagnosis statements for instructional purposes only. Students will be introduced to the EMR format for selecting nursing diagnoses and documenting supporting data to prepare them for their clinical experiences and professional nursing practice. The EMR format of 1, identifying patient-appropriate nursing diagnosis, and 2, listing clustered supporting data, including the etiology, underlying cause, will be used throughout the textbook when discussing the diagnosis steps of the nursing process. Nursing diagnosis is the nurse's clinical judgment about a client's response to actual or potential health conditions or needs. The nursing diagnosis follows assessment in the nursing process. In this step, the nurse makes clinical decisions about a patient's experiences and responses to problems or life events identified during the data collection process. Identification or correct nursing diagnosis depends on accurate collection, validation, analysis, and clustering of data. Careful consideration of the patient's subjective symptoms and objective signs. Assessment data identifies if a patient has an existing or potential problem or is seeking to help improve his or her lifestyle or situation. Patient assessment data is clustered. A nursing diagnosis is identified, and supporting data is listed as part of the diagnosis steps in the nursing process. Figure 7.1. Differentiating medical and nursing diagnoses. Whereas medical diagnosis identify and label medical, physical, and psychological illnesses, nursing diagnoses are much broader in focus. Nursing diagnoses consider a patient's situation, or more holistically, including how the patient is responding to current circumstances. Nursing diagnoses take into consideration a patient's attitudes, strengths, and resources, not just the medical problems identified, which are critical for the planning holistic, individualized care. Nursing diagnoses are clinical judgments or decisions made by nurses based on patient assessment data. Nursing taxonomies. Before the 1970s, there was no uniform, systematic method used by nurses to identify patients' health concerns. Assessments were completed and data collected, leading to identification of patient problems without a standardized method of communicating the findings. Nursing care was primarily guided by physicians' orders and directed at treating the signs and symptoms specific to medical diagnoses. Now, several organizations have developed taxonomies to guide nursing care throughout the world. Evolution. The first unofficial nursing diagnosis conference with 100 nurses in attendance was held in 1973 to develop a nursing taxonomy. The nurses continued to meet every 2 years until 1982, when the group officially became the North American Nursing Diagnosis Association, or NANDA, NANDA-I in 2018. NANDA pioneered work in nursing language and classification with its identification of nursing diagnoses. The organization is composed of nurses from all areas of nursing, including practice, research, education, administration, and specialty areas. In 2002, NANDA became NANDA International, NANDA-I, to acknowledge the increased interest in nursing taxonomy worldwide. The initial goals were to generate, name, and implement nursing diagnostic categories. These goals exist today in addition to the goals of revising the taxonomy, promoting research to validate diagnostic labels, and encouraging nurses to use taxonomy in practice. In the early 1990s, the American Nurses Association, ANNA, supported the collaboration of multiple classification systems utilized for acute home and community care to develop the ICNP taxonomy by the ICN. The ICNP incorporates nursing diagnoses similar to, and in some cases identical to, NANDA-I labels. Outcomes that are dependent on nursing actions and nursing interventions, ICNP nursing diagnoses, are incorporated into EMRs and are recognized by the World Health Organization, WHO, for use of nurses internationally. Cycle of revision. The NANDA-I and ICNP taxonomies are dynamic. Every 2 to 3 years, both taxonomies are evaluated and revised based on nursing research conducted to validate current and evolving nursing practice. Diagnoses are accepted based on how well research supports them. Nursing students and nurses for whom English is not their native language may find it helpful to refer to one of approximately 20 ICNP translations available on that website. The complete NANDA-I taxonomy includes new nursing diagnoses is published in Nursing Diagnoses Definitions and Classifications. NANDA-I, Nursing Diagnostic Statements. 3 types of nursing diagnostic statements. Problem-focused, risk, and health promotion may be written in NANDA-I format. Determining which type is needed for each patient can be challenging. Figure 7.2 is an algorithm to help nurses with decision-making process. Nurses may identify one or more of each type of nursing diagnosis for a patient depending on the patient's current health status or situation. It is important that all applicable nursing diagnoses are recognized to guide patient care. Determining the priority in which to address each nursing diagnosis takes place during the planning phase of the nursing process. Problem-focused nursing diagnoses are clinical judgments about undesirable human responses to health conditions or life processes that occur in an individual, family, group, or community. Risk nursing diagnoses identify risk factors that are vulnerabilities of an individual, family, group, or community for developing negative human responses to health conditions or life processes. Health promotion nursing diagnoses are clinical judgments concerning the motivation and desire of an individual, family, group, or community to increase well-being and to actualize human health potential. When writing health promotion during nursing diagnoses, the clustered supporting data, i.e. defining characteristics, should reflect a verbalized desire to address positive lifestyle changes and increase healthy behavior. After nursing diagnoses have been established and goals and interventions are planned, patient care is provided, often in collaboration with a variety of healthcare professionals or agencies. Patient education needs to be included as part of patient care in most cases. Each of the 3 types of nursing diagnoses require the nurse's clinical judgment, which is based on patient assessment data, knowledge, and nursing experience. Components of NANDA-I nursing diagnostic statements. Each type of nursing diagnostic statement contains sections or parts to comply with NANDA-I guidelines. Problem-focused nursing diagnostic statements are written with 3 parts: a diagnosis label, related factors, and defining characteristics. Risk nursing diagnoses have 2 segments: a diagnosis label and risk factors preceded by the phrase, as evidenced by NANDA-I 2018. Health promotion nursing diagnoses also are written with only 2 sections: the diagnosis label and the defining characteristics. Diagnosis label. The NANDA-I diagnosis label is a concise term or phrase that represents a pattern or related clustered data. The diagnosis label is the first section of NANDA-I nursing diagnosis statements, and it describes the diagnostic focus and requires nursing judgment before its assignment to a patient. A nurse must be familiar with the patient's signs and symptoms and the etiology of any potential problems, or needs before determining an appropriate nursing diagnosis label. To accurately identify diagnosis labels for a patient, the nurse must 1. Understand the meaning of a diagnostic label, 2. Cluster and analyze related assessment findings, and 3. Make a clinical judgment based on the patient's condition. All risk NANDA-I nursing diagnoses begin with the words Risk 4. All health promotion NANDA-I nursing diagnosis labels begin with the words Readiness for Enhanced. Nursing diagnoses from NANDA-I or other taxonomies such as the INCP or CCC may be used within the NANDA-I structure. If that wasn't confusing. Related factors. According to the NANDA-I guidelines, the second part of a problem-focused nursing diagnosis consists of related factors. Related factors are the underlying cause of etiology, of a patient's problem. Reviewing a patient's history can help the nurse determine accurate related factors. Nursing interventions are planned and implemented in the next 2 steps of the nursing process to treat the related factors identified as the cause of the patient's problem. Defining characteristics. Defining characteristics are traditionally written as the third section of a problem-focused NANDA-I nursing diagnostic statement. In the case of a risk or health promotion nursing diagnosis, risk factors or defining characteristics are the second rather than the third component of the nursing diagnostic statement. Risk factors that are identified in a risk nursing diagnosis are environmental, physical, psychological, or situational concerns that increase a patient's vulnerability to a potential problem or concern. Defining characteristics are cues or clusters of related assessment data that are signs, symptoms, or indications of a problem-focused or health promotion nursing diagnosis. Nursing diagnosis in the electronic medical record. Within the EMR, nurses have the responsibility to identify and document nursing diagnoses for each patient based on sound clinical judgment following assessment. Nursing diagnoses in an EMR are typically chosen with a drop-down list that originates from taxonomies such as the ISC, NP, or CCC. Once the nurse chooses an appropriate nursing diagnosis based on clustered patient data, the nurse selects or manually enters patient-specific supporting data, including the etiology and signs and symptoms related specifically to the diagnosis. Although the process of documenting specific nursing diagnoses and their supporting data is simplified within EMRs, the nurse retains the responsibility to identify relevant patient data to avoid errors in individualized care planning. Steps for identification of accurate nursing diagnoses. Accurate identification of nursing diagnoses requires an analysis of assessment data and clustering of related cues and information. All patient information should be considered as potentially contributing to the identification of diagnostic labels. This information includes subjective and objective data collected through physical assessment of the patient, interview of the patient and family members, and laboratory and diagnostic test results, including x-rays, physician's orders, and documentation from healthcare providers. Verifying specific nursing diagnoses for a particular patient or situation follows accurate analysis and clustering of data. Data clustering. After collecting and reviewing all the assessment data, the nurse looks for patterns and related data to support specific nursing diagnoses. This process is referred to as clustering data. Clustering involves organizing patient assessment data into grouping with similar underlying causes. The nurse looks for cues among the data that support the diagnosis of a problem. For example, objective and subjective data related to mobility can be clustered. Data related to nutritional status, such as weight, height, and dietary intake, can be clustered. One patient may have several problems simultaneously requiring the nurse to understand the potential relatedness of signs and symptoms from various body systems. The nurse combines an understanding of pathophysiology, normal structure and function, disease processes, and symptomology to accurate cluster data. For example, a patient with congestive heart failure may have the following seemingly diverse but related assessment findings. Subjective data. Patient reports weight gain of 10 pounds in 48 hours. Patient complains of shortness of breath. Patient complains of feeling tired all the time. Objective data. Bilateral bacillar cracks in the lungs of auscultation. Bilateral 2+ pitting edema of the ankles and feet. Although these individual assessment findings may seem unrelated at first glance, they are all signs and symptoms of heart failure that should be clustered to support the nursing diagnosis of hypervolemia, ICNP. In other circumstances, cluster data related to only one body system is support of a nursing diagnosis. The following data would be clustered to support the nursing diagnosis of impaired gas exchange. Subjective data. Patient states, I am having difficulty breathing. Patient complains of getting winded and with activity. Objective data, dyspnea or on exertion. Pulse oximetry readings of 88% on room air. The nurse finds that some data or cues may support more than one type of nursing diagnosis. For example, difficulty with mobility or ambulation observed by the nurse and verbalized by the patient can be a defining characteristic for a NANDA-I problem-focused nursing diagnosis or supporting data and an EMR documented as impaired mobility. With supporting data of limited range of motion, slow, unsteady gait, and patient states, I am having a very difficult time walking. The patient's difficulty with the mobility may also make the patient vulnerable to developing constipation or decreased peripheral blood circulation. In this case, the patient's plan of care may include the nursing diagnoses of risk for constipation. With supporting data of decreased peristalsis and limited ambulation and risk for impaired peripheral tissue perfusion. With supporting data of the limited mobility, increased potential for deep vein thrombosis, and patient states, I am having a very difficult time walking. Analysis of patient assessment data may yield several clusters or related data or cues. It is common to apply several nursing diagnoses to one patient. This is especially true for acutely ill patient with multiple problems related to complex physical or psychological needs. For example, one patient may have ICNP nursing diagnosis of acute pain, risk for fall-related injury, powerlessness, and impaired sleep. Diagnostic validity. Before selecting nursing diagnoses, the nurse reviews available options for either the taxonomy in the EMR or the NANDA-I list to ensure accurate use of the diagnosis. The nurse chooses nursing diagnoses within the EMR or writes nursing diagnostic statements as needed to address the highest priority needs of the patient. These diagnoses are uniquely based on the assessment data of each patient. Accurate nursing diagnoses are foundational to the development of an effective personalized plan of care. Avoiding problems in the diagnostic process. A variety of errors in identification in NANDA-I statement structure or statement content may occur when determining nursing diagnoses. These include clustering unrelated data, accepting erroneous data, missing the true underlying etiology of a problem, using medical diagnoses as related factors in NANDA-I nursing diagnostic statement, and identifying multiple nursing diagnosis labels in one NANDA-I nursing diagnostic statement. Blah. Data clustering. Clustering unrelated data most often occurs when the nurse has not completed a thorough review of the patient's assessment information or is missing important data. For example, at first glance, a patient's inability to urinate and minimal oral fluid intake may seem related. However, after further review of the data, the nurse should realize that they are not related. The patient has an IV infusion running at 150 milliliters per hour that provides adequate hydration as well as the patient's post-operative status after abdominal surgery. In this case, the patient's inability to urinate most likely results from having an abdominal surgery and may be expected depending on when the operation was performed. Clustering unrelated data can be avoided with more information. Accurate data collection. Errors in data collection, omitting key information, or An incomplete understanding or knowledge of assessment techniques or a patient's condition may lead to the inclusion of erroneous data in a NANDA-I nursing diagnostic statement or supporting data lists. It is the nurse's responsibility to collect accurate, extensive assessment data and analyze them on the basis of accurate scientific knowledge. Poor assessment skills or misinterpretation of assessment findings may lead to improper treatment and poor quality patient care. It is the nurse's responsibility to stay current in nursing research to provide the best care possible. Safe practice alert. Research is being conducted on a continuous basis in the discipline of nursing. Evidence-based nursing practices should always be the realm within which the nurse practices. To ensure safe nursing practice founded on empirical research results, the professional nurse must commit to reading about, discussing, and disseminating the most current and best practices for nursing care. Inaccurate documentation of the data may lead to errors in diagnosis. Accurate documentation is essential to ensure patient safety and to facilitate communication among healthcare professionals. For example, misinterpretation of a critical laboratory value or recording the absence of dependent edema, although it exists, prevents the accurate diagnosis of patient needs and may endanger a patient's life. Formulating related factors. The underlying etiology or cause of a patient's concern or situation rather than a medical diagnosis should be used as a related factor when writing a NANDA-I nursing diagnosis statement and can be included in the list of supporting data in the EMR. By doing so, the nurse articulates an understanding of the pathophysiology or situation with which the patient is faced. For instance, for a patient who has a medical diagnosis of pneumonia and has an oxygen saturation of 88% on room air, the first two sections of a proper NANDA-I nursing diagnostic statement may be impaired gas exchange. Related to poor alveolar perfusion, the medical diagnosis of pneumonia, restlessness, change in mental status, and dyspnea can be clustered with the other data as defining characteristics of a NANDA-I statement, or identified as supporting data along with the etiology, poor alveolar perfusion in the EMR. Identifying the correct cause. The related factor in a NANDA-I problem-focused nursing diagnosis needs to address the underlying etiology of the patient's problem expressed by the nursing diagnostic label, rather than listing data that are defined characteristics. This can be achieved by thinking of the related factor as a broad statement of causality rather than the specific data or cues that support the diagnosis. The related factor in a problem-focused NANDA-I nursing diagnosis statement needs to be significantly comprehensive in nature to direct the focus of future nursing interventions. For instance, this is a properly stated problem-focused NANDA-I nursing diagnosis statement: impaired swallowing, related to neuromuscular impairment as evidenced by aspiration with liquids noted during swallowing study, observed choking when trying to take liquids in patient verbalization, I can't swallow without choking. Remember that the related to section in a NANDA-I diagnostic statement needs to identify the underlying cause of the nursing diagnosis, which is supported by the data listed as defining characteristics. The EMR, the supporting data for impaired swallowing, would be neuromuscular impairment, aspiration for liquids noted during swallowing study, observed choking when trying to take liquids, and patient verbalized, I can't swallow without choking. Focusing on one problem at a time. When writing a NANDA-I nursing diagnosis statements, the nurse should avoid inclusion of more than one label in the statement. Regardless of the type of NANDA-I nursing diagnosis statement being written, only one label should be used in each statement. For example, a preoperative patient who is anxious about surgery and has diarrhea due to the surgical preparation should have these two problems addressed as separate nursing diagnoses. The nurse would not start off by stating anxiety and diarrhea related to ... To address the separate concerns of this patient accurately, the nurse would write two NANDA nursing diagnostic statements. One would begin anxiety related to, the other would begin diarrhea related to. Both are approved nursing diagnoses in the ICNP and NANDA taxonomies. Including more than one nursing diagnosis label in a NANDA-I diagnostic statement causes confusion and may prevent the identification and treatment of critical patient concerns due to lack of organization and focus. Application to patient care. By identifying appropriate nursing diagnoses, the nurse enables accurate development of individualized patient care plans of care. The nursing diagnosis step of the nursing process leads the nurse to the planning phase, which begins with prioritizing the identified nursing diagnoses. Nursing diagnoses and patient outcomes, which are established during the planning step, help the nurse determine appropriate interventions for patient care. Chapters 8 and 9 provide more information on nursing interventions and individualized plans of care based on nursing diagnoses and identifying patient outcomes. Ultimately, nurses are accountable for formulating accurate nursing diagnoses and intervening appropriately. By collecting accurate and complete assessment data and identifying specific nursing diagnoses for each patient, the professional nurse has a significant impact on patient care outcomes, the quality of patient care, and patient satisfaction.